Hi, good evening. I'm Luis Velasquez, MD, and I'm gonna make this emission of Health Life about patient to perfectionate it step by step. Okay, so this is an episode that or an emission that I decide to talk or pick for a lot of them, and that it's about that condition that have each patient that make different and unique to the rest of the people. Okay, so that really is something. This is a them that I don't have make in Spanish yet. I have the idea 2 hours ago, and it's just important to know to any doctor that there's some conditions that make that patient make different to another. When I give class, I always make that example about twins that homozygote twins that have high blood pressure, and exactly the same number. Okay, and you give the same treatment, the emergency treatment, to make that the blood pressure get down, and probably one of the patient and the blood pressure down, and the other not, and even they are twins. Okay, and sorry for my bad English again. And it's that makes really complicated the exercise of the medicine, and that made really that reinforce the empiric medicine that the practice with the years make that the doctors make better, and it's really make hard that kind of that kind of condition that and you can question why to some medicine is effective in some persons and is not effective in another people. That have to be a lot of condition, and the genetic the each person have a different genetic ADN genetic, and you have probably receptors in your body, or the place, the site where the medicine act is it's high in some persons and low in other persons. Okay, another conditions like the the race of the person, and there's some medicines to get down the blood pressure. That is some that the calcium antagonist is better to the race from Afro-descendant. Okay, um, and is better treatment this kind of calcium antagonist for these kind of people. Okay, another things is the proportion of fat in the body of the person, the uh, and the age, the sex, the and other conditions like if the person have treatment with another drugs that can be antagonist of the treatment that you are given to that person, and the metabolism of any people. There's person that is fast acetylate. Give me a second. Yes,
ACETYLATOR.
and there's not a translation to acetylator. I think it's that it's high in some person and is slow in another, and that is a condition to a people, another person. If you give to a high a fast acetylator a drug that can be sympathetic and mimetic, and probably that person gonna to have a bad reaction to that drug. Okay, that the person that is a pseudo acetylator. Okay, and that makes that you have to probably the dose of drug and the frequency of that drug to the person. You have to make change to the patient, the food, the alimentation, the food. Sorry, the food, the feeding of the person too is it's important. Okay, and a lot of conditions that make different. If the person have any kidney problem, that's extremely important. Or a liver problem, a liver disease. That saludamos a Gabriela en español, ¿verdad? Porque probablemente siempre lo digo en español. Y de cuando en cuando yo hago uno en inglés, ¿ok? Saludamos a Gabriela Ramírez, 6160. And if the person have a liver disease, okay, that's you have to make that you have to give a drug that you have to eliminate of the body by the kidney, because the person have a liver in a bad condition for any disease. And the other way too, if you have a patient that have a problem with the kidney, you have to give a drug that the metabolism is in the liver, because the kidney is in bad condition to make that elimination of the drug. Okay, and that make it really really difficult the exercise of the medicine, the practice, the medical practice. And for the cardiologist is important this idiosyncrasy, patient idiosyncrasy. And that is a really good example of the drugs to make low the blood pressure, and because they try one drug and another, and then and to until find the drug that is exactly the drug for each patient, like a ring to the finger. Okay, and that is really a problem. Okay, so if you are if you are a medicine student, you have to make that you can control the mind, the theory, but the practice of the medicine is really complicated for this um, patient idiosyncrasy. Okay, and so I'm Luis Velasquez, MD. I'm a Venezuelan doctor, and I'm here in Ecuador. It's a beautiful country in Guayaquil, in the south of Guayaquil, and I do these videos in this language, beautiful language, because the people that talk English don't like to read. Uh, this Facebook and YouTube have the subtitles, but don't like to read, and I want to perfectionate my English, and in this is a perfect way to force me to perfectionate this um, beautiful language that I'm trying to do mine step by step. So the WhatsApp 096 280 4166, and the webs the uh, the networks. It's Instagram CM Alianza Latinoamericana. Dr. Luis L. Velázquez S. Separate with the underline, and Dr. Luis Alianza separate with underline, and the Facebook Luis Velázquez, the YouTube channel Luis Velázquez, And any question you can make me for this way. Okay. So goodbye. See you later. Goodbye to people in YouTube. Goodbye to people.